speaking about. It's very, very harmful to huge swathes of different sectors across the country.
We're going to talk about drugs policy. We're joined by the Conservative MP Crispin Blunt, who launched the Conservative Drug Policy Reform Group and has a major report out tomorrow. Welcome to you. Crispin, your report has some research on MPs' attitudes to drug reform. What have you found out? Give us a preview of what's in the report.
Well, I think it's very good news in as much as MPs, strange enough, reflect the views of most of the rest of the population, is that our drugs policy isn't working. It is not properly based on evidence. And I think it signals to the government that they have considerably more room for manoeuvre than they might think in considering how to reframe drugs policy. 61% of Conservative MPs agree with the statement that if we're to improve the way we tackle the problems caused by controlled drugs, we need to change how we make drug policy. Now, in your introduction, you said I wanted to change the laws. The first thing to do is to change the analysis and to create the basis on which we can change the laws by having a proper consideration of the evidence and a proper research capacity.
Right, OK. Well, you've raised that issue. I mean, are you personally talking about liberalisation or just reform within the remit that you have sort of set yourself? I mean, would MPs or even you like to see legalisation of cannabis like we've seen in Malta, for example, or something like decriminalisation?
Well, the government is very clear that it's not going to decriminalise or legalise adult use recreational cannabis. But we are going to see a significant number of examples. We've already got 13 American states, we've got Canada, we've got Uruguay, as you said, we've now got Malta, and it looks as though we might get Germany in the next year or two once they design how they intend to do it. And it's there that the key evidence and data can be collected. All these countries are doing a fantastic service to us because it is the regulations and the licensing conditions that will determine whether or not you're going to maximise the reduction of public harm and the maximisation of the public benefit if you choose to go down a legalisation route.
All right,
it's how you do it's correct that is important.
Right, well, stay with us because we've got obviously two other MPs here. Andrew, have you got an appetite for real reform to drugs policy?
I think where Crispin is right is that we need to reform of how we conduct the analysis, and it will be very interesting to see the data coming from Malta as we examine the data coming from states in America, Canada, Uruguay that have already decriminalised cannabis for recreational use. I personally am not convinced right now that that's the road that the UK should be going down. I think there's still huge questions over psychosis and cognitive dissonance effects on that, and we need to see whether legalisation actually leads to more frequent use, which could be damaging to society as a whole. However, I'm open to looking at the evidence and taking evidence-based approach on changing drugs policy in this country. It's quite clear the policies that we have right now are not working, and so we need to do something, but I'm not convinced that legalisation of cannabis yet is the way that we need to go.
Andrew's not convinced. What about you, Emily?
No, I mean, I keep an open mind on this. I do listen to the evidence. And actually I changed my mind from being somebody who was in favour of legalisation to really not thinking it was a good idea when I became an MP. Well, because the cannabis itself has changed, it's much stronger. And then I heard from constituents about what was happening on the ground. It isn't some sort of utopian kind of, fluffy drug quite often. It's actually its effects can be very serious and it can have quite grave social effects. I heard from an old lady who, for example, who wasn't going to go down in her lift to get out of her block of flats because there was always a gang of boys there and she was frightened of them. They were bound very closely together. They spent their time smoking. But listen, I'm not saying that we shouldn't be looking at evidence, and I welcome the fact that the London Mayor has got an inquiry going into it. So let's keep an open mind on it, but let's also be realistic about what it is that we're talking about. And cannabis is now much stronger than it used to be. Now, if we're going to legalise it and we're going to regulate it, then how would we regulate it and make sure that it wasn't any of the stronger stuff that came out? And how do we make sure that that's illegal and the gentler stuff is not?
Crispin.
I mean, all of these questions need some answers.
Crispin?
And Emily is right there. The reason why we have such a level of psychosis in the young from cannabis in the UK is it is criminally supplied and it's made super strong And if you are inclined to have a mind vulnerable to psychosis, then it's going to trigger it. And of course, it is sold to children. And children find it much easier to get this very strong cannabis than they do alcohol, because alcohol is now almost entirely a legal business. And people know what the products are, and the products have to be sold through licensed premises, and they'll lose their business if they sell to children. And so the Canadian case for legalization did rest on protecting children and reducing crime. And that's why we need to advance on this, a proper examination. All the evidence is now going to become available to us from a whole bunch of different jurisdictions around the world. And the overall object must be to reduce the harm to the public. And at the moment, we have policies that create the harm, and they line up the criminals with the users,
all right,
to the detriment of all.
All right, I'll come back to you more broadly on the drug strategy. But Helen, listening to that and what Andrew and Emily have said, do you think regulation would protect enough against the very strong substances of cannabis and the impact on children and their access to it?
It's hard to say. I mean, my mum was a psychiatrist and she successfully scared me off smoking weed by telling me about the psychosis among her, particularly male patients, actually. On the other hand, there's a lot of evidence which shows that smoking tobacco and alcohol has far higher mortality risk, and we let people do that. But I do think actually at the moment there's already effectively tolerance for smoking cannabis. I looked through the court list this morning, the Magistrates' Court in Manchester, to see if anybody was actually up on charges of cannabis possession, and those that were, it was like the most minor charge on the charge sheet. They were up for much more serious offences, whether that was dealing, heroin, Class A offences. So I think it's already tolerated in society. It's just whether the government has got the appetite for showing some bravery, really, and a bit of bold political leadership in saying it's not working, instead of suggesting that the solution is taking people's passports off each other if they're found to have done a line of coke at a dinner party or whatever.
Crispin, is the appetite really there? Is the groundwork being laid in the drug strategy that we've had from the government?
Part of it is. The half of the strategy that's aimed at treatment, which reflects the work done by Dame Carol Black, is really excellent. There's a great deal more money going into treatment services, the money having gone out over the last decade or so. And so far as one can tell, that money is going to be reasonably ring-fenced. It's going to be very difficult for the government not to have that money follow the treatment services. That part of the policy has been then enveloped in this language about middle-class drug users, who will tend to be non-problematic, are the ones who are not then going to end up needing these treatment services, and they're the ones who are not really being supplied by county lines in the way that has been suggested.
All right, well, let me put... Yeah, but
can I just say, I just don't think that's right. Crispin, I mean, I agree with a lot of what Crispin says quite often, but there's a load of nonsense. You can't make a class distinction when it comes to the effect of drugs on people. You're really saying that the effect on the middle classes is much milder than it is on working class people?
No.
All right, well, then I misunderstood you.
I mean, the difference I would draw is between problematic and non-problematic drug users. And by and large, we will find problematic drug users are the 10% of users and this pattern repeats itself for very many different types of drugs, including legal ones like alcohol, where people will use the drug to mask and treat some other pain in their life.
All right, well, hang on, because I want to get to Iain, because I'm not sure how you could make a separate category or certainly legislate for it in that sense. But broadly, Iain, I mean, do you think there is government appetite to change this? I mean, Andrew and Emily both have reservations about anything to do with legalising cannabis, but it's interesting what Helen said about the tolerance being there. Is that far enough to just treat it in a slightly different way, perhaps not criminalise everyone, and you treat it in the way Scotland has tried to, with a health approach?
Possibly. I mean, I share Emily's concern and Andrew's concern about strength and things being very different from 30, 40 years ago. But I would be cautiously in favour of reform on the basis that the current policy clearly isn't working. And there's also something globally which is happening, which is that you've got a medicinal cannabis-based industry developing very fast, and it's a huge opportunity. And as long as that's properly regulated, interesting things are happening there. And then you can start to see internationally the spread of this move towards legalization or decriminalization. So I just think that the drift of policy is going to require some sort of really serious, balanced look at the evidence, and it's going to over the next 5 to 10 years. But I'm cautiously in favour of reform.
Crispin, we've run out of time, Crispin, but so I'm afraid we'll have to leave it there. But thank you very much for joining us and talking to us about the drugs policy, because I want to ask everybody, perhaps difficult after all the information that we have just had on the programme,